Alcohol withdrawals are very serious. In this video, we're going to talk about what they are, how they differentiate from a hangover. We'll talk through the different symptoms and their severity. We'll talk through the treatment options and what to do if you or someone you know is experiencing withdrawals. If you're new here, welcome. My name's Dr. Sil. I'm a psychiatry registrar in Australia, which means I'm a junior doctor in training to become a psychiatrist, and it also means that I deal with a lot of patients who are experiencing alcohol withdrawals. And if I'm honest, right now I'm a little bit hungover. It's Sunday morning and I had a bit of a night with some friends last night, maybe one too many beers. And so I thought this is a very topical video. So let's get into the video. What is alcohol withdrawal syndrome or withdrawals or alcohol withdrawal symptoms or the alcohol withdrawal scale? There's so many different kind of ways to call it. Well, essentially, it's a set of symptoms that occur when someone who has been drinking a large amount of alcohol for a large amount of time stops drinking or reduces their drinking significantly and can be extremely dangerous and even life-threatening. Typically, the longer and more heavier one has been drinking alcohol, the worse and more severe the symptoms are because they're proportional to the dependence one has developed to alcohol. The symptoms include sweating, tremors, anxiety, irritability, nausea, vomiting. The two life-threatening symptoms to be aware of are withdrawal seizures, which can be life-threatening. Obviously, when you're seizing, you're unconscious, you can fall, hit your head, vomit, and aspirate, breathe in the vomit and the fluids and the foaming saliva. You can bite your tongue and bleed and swallow that blood into your lungs. And, seizures can be really bad. And you can also develop a delirium tremens, which is this neurological syndrome where someone is confused, hallucinating, and can even become febrile and really unwell. These are medical emergencies and you have to go to hospital if you develop either the delirium or the seizures. Now, these are the different symptoms people can experience. Not everyone will experience all of these symptoms. Now, before we talk about the treatment to prevent these symptoms, because there are treatments available and there is hope and you can come off of alcohol if you need to, let's talk about the difference between a hangover, which is what hopefully I'm experiencing, and actual withdrawals. Now, to understand the difference, you kind of just have to understand a little bit about what's happening neurobiologically, which is essentially if you've been drinking alcohol for a long amount of times, you have a difference in the expression of different receptors. For example, alcohol is GABAergic, and GABA is a neurotransmitter that is an inhibitor. It is a depressant kind of neurotransmitter. If you drink heaps of alcohol, the expression of that neurotransmitter and the receptors decreases because the alcohol is acting in surplus, and so they decrease the receptors. But the problem is then when you stop the alcohol, you have less GABA receptors and neurotransmitter, and so you have essentially a decreased GABA state. Decreased GABA, which is the inhibiting neurotransmitter, means increased anxiety, increased agitation, tremors, sweating. That's where you get these symptoms from, and that is the withdrawal symptoms, as opposed to a hangover. So if you just drink once in a blue moon, but a bit too much, you're actually just getting the intoxicant effects from the alcohol. Alcohol makes you dehydrated because you drink less water. It inhibits the antidiuretic hormone, so you wee more. It also increases inflammatory state by increasing certain cytokines that make you feel crappy. So losing more fluid can cause electrolyte imbalances. The cytokine release can make you feel crappy. Essentially, that's a hangover, and you need electrolytes, Panadol, and a lot of fluid to get over that. But it isn't life-threatening. Whereas alcohol withdrawals, if you've been drinking a lot of alcohol over a long period of time, that's actually because the neurons have adapted to the alcohol and changed their receptor expression to adapt to the higher levels of alcohol you've been ingesting or one has been ingesting. So just to make that clear, they're two different things. And a hangover is not a type of withdrawal, and a withdrawal is not a type of hangover. But you can have both at the same time, I guess, but they're different neurobiological processes. Now, what tends to happen with people who have alcoholism or alcohol use disorder is they start to get the withdrawals when they wake up, and so they start drinking to repress those withdrawals. So if you're having a drink first thing in the morning, that's a problem. That's a huge problem, and you need to get on top of that. So the options for treatment, if it's an emergency, if someone is delirious or not making sense or seeing visual hallucinations, call an ambulance. That this person needs to go to hospital. If someone is not in an emergency, you can go to a GP or call a drug and alcohol support phone line. And just Google drug and alcohol support. Every state, every country has their own services. They might offer rehab, they might offer a consult. But in Australia, if you see a GP or go to the hospital, they might prescribe medicines to help essentially reduce the risk of getting seizures and help you kind of withdraw from alcohol safely. There is nothing that'll make it good. It's going to suck. There's no way around it. It's the price you pay for long-term drinking, unfortunately. But it's much better to do it in a safe environment with the right medicines. The medicines are benzodiazepines, usually high-dose diazepam or Valium, and it's up to the doctor to dose it or to decide if you need it or not. Obviously, Valium and benzos are a medicine that is Schedule 4 and is a drug of addiction, so they can't overprescribe it. They have to be doctors have to be very careful and cautious about how they prescribe those medicines. But a massive point to remember is never take a benzo and alcohol at the same time, right? Never take Valium and a shot of vodka at the same time. You gotta, if you're taking the benzos, you can't drink alcohol, and if you're drinking alcohol, you can't take benzos. So look, to conclude the key points here, it's really that withdrawals can be a life-threatening condition. So have a low threshold to going to hospital or calling an ambulance for someone who might be experiencing them. Often people have to end up in ICU with monitoring, especially if they have delirium or seizures. And the key thing is there is treatments of options available. We talked about some of the quicker treatments. The longer term treatments include psychology and psychotherapy around why you're taking drugs and alcohol. That's the most important part. And usually the why is around escapism. What are you avoiding? What feelings, what trauma, what incidents are you trying to repress and forget about? It can also be a self-confidence things, like maybe you hate yourself and you're trying to escape from yourself, and maybe it's a form of self-harm to kind of end life quicker. So all these things need to be talked through in a sober state, because you're stuck with your body, and you got to get along with yourself, and that requires a lot of work, but it's absolutely doable. I've met plenty of patients who had alcoholism in their 20s and 30s, and now in their 40s and 50s with families and happy and off of the drugs and alcohol. Often, you got to go cold. You got to never drink again. You kind of it's very hard to go from alcoholism to a moderate drinker. You usually just have to stop forever. And that's very shocking, to hear, because people are dependent on their alcohol. But think about it. It's kind of a no-brainer after a while. All right, I'll put some phone numbers in the description below if you're from Australia. Wish you all the best, guys. I'm gonna go drink a Powerade or something, get some electrolytes, and I'll see you all in the next video. All right, bye for now.